Test 1, 2. 1, 2, 3, 4, 5. Testing 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5. Test 1, 2, 3. Testing 1, 2, 3, 4, 5.
Good morning and welcome, Governor Beshear. On behalf of U of L Health, it's an honor to have you visit our hospital this morning. We greatly appreciate your interest in this historical moment in our Commonwealth and our nation. I would like to personally say thank you for your tireless effort to protect our community throughout this pandemic. You, Dr. Stack, and others have provided us with vital PPE for our staff. We have been partners together in providing free testing for the community. You have worked to protect all those in the Commonwealth, and today you're here to show your support for the many heroes who provide direct medical care during this pandemic. On behalf of the 12,000 team members at U of L Healthcare, I want to say thank you for all you're doing. The arrival of this vaccine represents hope for this community and a significant step forward in the arsenal to protect us from this virus. I want to recognize Jason Smith, our Chief Medical Officer and Trauma Surgeon, for his leadership in response to the COVID-19 pandemic. I applaud his leadership in engaging our community and desire to set an example to be the first to take this vaccine. I also want to thank our nurses, LaShawn Scott, Beth Sum, Drs. Valerie Briones Pryor, and Dr. Mohammed Saad. Thank you for your willingness to be part of this. Your example you set today is another demonstration that you truly are healthcare heroes. Thank you for representing all of our team members. I am now honored to introduce the Governor of Kentucky, Andy Beshear.
Good morning. This is, I think, the best day that I've had since March the 6th of this year. Today is a truly great day in the Commonwealth, a historic day, a day that we have hoped and prayed for over 9 months of sacrifice, of pain, and of loss. We are here this morning at the University of Louisville Hospital to mark the true beginning of the end of this pandemic. And hopefully, while it starts here, it spreads out across this country and across this world. Today, we can see victory. We can see the defeat of the coronavirus and the end of this pandemic. Yesterday, the first shipments of this vaccine arrived in Kentucky. Approximately 38,000 doses of the Pfizer-BioNTech vaccine arrived nearby at Louisville's UPS Worldwide Hub in Kentucky. Today, 3 hospitals, Baptist Health in Lexington, the Medical Center in Bowling Green, and here at the University of Louisville Hospital in Louisville, we will begin administering 975 doses of the Pfizer vaccine at each location. In a moment, right here, we will see the first vaccinations in Kentucky. And rightfully so, they will go to our healthcare heroes, those that every day have stepped into harm's way to care for those who need their help, who have seen difficulty, who have seen death, who have seen loss in a way that most of us haven't, not just numbers or even names, but the true human toll of what it's like when somebody passes away, unable to see their family. These folks have fought this fight for us. Sometimes they fought it in spite of our actions. They haven't complained. They've showed up each and every day to do their very best, and to them, we are eternally grateful. Today, we'll have our first 5 healthcare workers vaccinated, but it is just the start. And I know each of them would say that every other healthcare worker out there on the front lines is just as deserving. That individuals all across Kentucky have been doing the hard work, rolling up their sleeves every day to help us. And today, they get to roll up their sleeves to take this vaccine. This is a historic achievement that promises to save lives in this fight, restore our economy, get our kids back to school, and let our kids hug their grandparents once again. Since March 6th, when the first coronavirus case was reported in Kentucky, this has been the battle and the war of our lifetime. Even as we turn this important corner, we cannot forget the loss that we've sustained. We have lost over 2,000 of our fellow Kentuckians to this virus. Our neighbors, our friends, our parents. One of my close friends had to say goodbye to his mom, and then spend 2 weeks not being able to see his family in quarantine to protect them. That is not a unique story. There's more than 2,000 of them all across the Commonwealth. Through it all, I've been focused on trying to save lives. All our guidance and each of our decisions, and none of them have been easy, have been based on the best available science and advice from White House experts like Dr. Fauci and Dr. Birx to Dr. Stack to Dr. Smith. Today's achievement is another validation of the role of science in this battle. To get a vaccine this quickly and for it to potentially be 95% effective is nothing short of a modern medical miracle. And as we approach Christmas and we think about miracles, I hope we recognize how critical this one is and that we are all grateful for the opportunity of this vaccine as it is distributed throughout the Commonwealth. More than 12,500 initial doses of the two-stage Pfizer vaccine are being distributed right now to 11 regional hospitals that will receive them in the next 3 days. They're in Paducah, Bowling Green, Madisonville, Pikeville, Corbin, Lexington, Edgewood, and right here in Louisville. More than 25,000 doses are going to CVS and Walgreens, which have a federal contract to vaccinate those in our long-term care facilities. The booster doses for those will follow in about 3 weeks. We have to focus on our long-term care residents, first for the moral side. They make up 66% of the deaths here in the Commonwealth. And just think about it. Our goal is in the next 2 months to vaccinate all of them, meaning we can deal this virus a deadly blow while we are pushing towards victory. And those here in the hospital can tell you, when our long-term care residents are hospitalized, the amount of resources that they take up prevent these healthcare heroes from seeing more patients. Approval is expected any day now for the Moderna vaccine. This month alone, we could receive 150,000 doses of that vaccine. And again, we believe it is over 94% effective. And we in Kentucky are going to play a starring role, not just here, but nationwide in defeating this virus. I want to personally acknowledge and thank UPS, their officials, their workers, their delivery guy who brought it in here this morning, and who through UPS Worldport is going to be providing this vaccine all around the United States and to people all over the eastern coast. When the full history of this pandemic is told, Team Kentucky will have played a major role. These vaccines are a game changer that makes all of our sacrifices matter. Unfortunately, it doesn't mean that they're over. There's still going to be tough days and tough months ahead. And just because we have a vaccine doesn't mean people can let their guard down. Now more than ever, every death between now and when everyone has an opportunity to be vaccinated is one that we can avoid. We see victory. We must protect our people until we get there, continuing wearing masks, continuing social distancing, continuing doing those things that will keep our people alive. Those most at risk need to get this vaccine first. Our frontline healthcare workers and long-term care. And we need to be patient while they are the first vaccinated. It may take a while before the vaccine is approved for certain groups, such as children. Until we are all safe, everybody please remain vigilant. But today, for the very first time, we are vaccinating Kentuckians against COVID-19. And that is a very positive step. And it is the best news that we have had since the very start of this pandemic. And that's the best looking styrofoam box I've ever seen. With that, I'd like to introduce Dr. Jason Smith, Chief Medical Officer at U of L Health and Trauma Surgeon at U of L Hospital, who's going to walk us through the first vaccines. Let me just say, Dr. Smith, we've gotten to work together just about every day of this pandemic, whether it's directly or through Dr. Stack. Thank you for your leadership. Thank you for your willingness to fight this thing every day. We could not be here without you. I'm grateful. The Commonwealth is grateful.
Thank you very much. And it's a bit humbling to sit with the five of us here. You know, I think one of the things that's important for everyone to realize is that, you know, we're just five people, but we represent the healthcare workers within the state and across the nation who've really been working tirelessly to provide the best care possible for everyone who comes through every one of our hospitals, be it U of L Health, be it at the other hospitals within the Commonwealth, or be it the hospitals across the country. I'm fully in belief that this is a very safe and effective vaccine. I volunteered to go first because of that and to hopefully set the example for others. I think everyone you see here sets the example for not just our healthcare system, but the other healthcare systems in the state, as well as the other people in the Commonwealth, to understand that we are all in this together from the very beginning. We have all sacrificed. We've taken time away from our families. We've taken time away from our friends. Our lives, our children's lives have been disrupted. And as the governor said, today is the beginning of the end for hopefully this pandemic. It will take us a few months to get everyone vaccinated across the Commonwealth and across the country, but I don't think any of us are going to stop the fight or rest until that has occurred. And I know that I speak for everyone who's going to get this vaccine today and who will get this vaccine in the upcoming days from our organization and others, is I want to thank everyone for everything you've done, for everything you're going to continue to do for the next few months to keep everyone safe. And hopefully by this time next year, this will all be behind us and we'll be able to be back to something more normal as far as our daily lives are concerned. Our kids will be back in school. Our stores and restaurants are going to be open. All of the things that we cherish in our daily lives will be back to normal, and it starts today here in the United States. So I'm honored to be the first one here to do this. So I would like to ask Sarah Bishop to come up. Sarah Bishop is our infection prevention nurse here at U of L Hospital. She has worked tirelessly from the beginning of this and to help make sure that we've got the policies and procedures in place to take care of our staff and our physicians and our patients. So I want to thank her for that personally. She gave me my flu shot a few months ago, so she's going to get to give me this vaccine this morning. Let's knock this thing out.
You were waiting 9 months and a couple weeks for this.
Couple weeks, yeah.
This is definitely a super exciting day. Okay.
And that's the first Kentucky vaccination.
Sarah's awesome. I didn't even feel it.
You got a nice little.
You got a smiley face Band-Aid.
There you go. You mean it doesn't say Team Kentucky?
It doesn't say, get us some more Band-Aids. There you go.
All right, fantastic.
All right, I'd like to invite LaShawn Scott up. LaShawn is another one of our infection prevention nurses that's worked throughout the system. A lot of nights and a lot of weekends in order to make this happen, and she's been just fantastic. So I want to thank her personally and thank her for what she's doing this morning.
Second vaccination.
All right, I'd like to invite Dr. Valerie Briones-Pryor. Dr. Briones-Pryor is one of our hospitalists here with University of Louisville Physicians, working over at the Jewish Hospital campus of U of L Health. She has been instrumental in caring for patients since the beginning. She's taken a brunt of our non-ICU patients at admissions at Jewish Hospital, and again, has been on the front lines since the beginning of this. Yep. Next up is Beth Sum. Beth is one of our emergency department nurses, and she's actually one of our nurse educators at Jewish Hospital. She's been instrumental in developing and educating the nurses in the ER. And one of the things that from the emergency department is you never know what's going to come through the door. And so making sure that everyone stays protected and keeping them safe and healthy has been one of the jobs that Beth has undertaken. And she's done a phenomenal job with that. So, Beth, thank you for all you do, and thank you for doing this morning.
I figured out where Beth keeps her pen.
Yep. Usually about 3 of them stuck in different parts of her hair.
All right, number 4.
All right, and last but certainly not least, Dr. Mohammed Saad is our Chief of Pulmonology and our Director of Critical Care at Jewish Hospital. Dr. Saad has shouldered a significant burden caring for all the patients in the ICUs following COVID and helped developing really protocols from the very beginning. When the pandemic started, Dr. Saad was one of the first people in my office as we were starting to develop how to even begin to care for the patients coming through the doors. And so I don't think we would have had the response for this healthcare system without he and Dr. Briones Pryor stepping up and helping to lead that. So Dr. Saad, thank you very much for all you do.
And their fifth vaccination.
Done. Thank you so much.
So it is literally as simple as that. 5 vaccinations in the span of 5 minutes. No muss and no fuss. And so I want to encourage anyone who has the opportunity in the next few months to get this vaccine to please step forward and get this vaccine. If you're not worried about yourself, perhaps someone in your community or family you should be worried for, take it for them, if not for yourself. And I will be the first person to tell you that I absolutely believe this vaccine is safe, it is effective, and is going to change our way of life moving forward. So with that, I'll turn it back over to the governor. Thank you, Sarah.
Thank you, Sarah. Thank you, Dr. Smith. Thank you to all of our first 5 vaccinated here in Kentucky. These are frontline heroes, and today they're representative of frontline heroes across Kentucky and across the nation. We are grateful that our front line, which is our only line, has showed up every single day to protect us. Let us celebrate that we can see the light at the end of the tunnel, that we know we are going to achieve victory, that the end is coming closer and closer, and that we will defeat this pandemic in 2021. We have brighter days ahead of us, ones where we get a little bit of the old normal back, but we also realize the things we've seen, like compassion and kindness, our interconnectedness, can make us better moving forward. I want everybody to remember that we still need vigilance over these next couple months. Everyone we've lost is a tragedy, but certainly everyone we lose between this first vaccination and when everybody can get one is avoidable. So let's keep it up. Team Kentucky has fought awfully hard, and now we know that here in the near future, we're going to win this battle. Thank you. God bless Kentucky. God bless the United States of America. And thank you, Lord, for this vaccine. All right, we will open it up for questions for those that have them. Debbie, you want to kick us off?
You know what the schedule is for vaccinations here at U of L and throughout Kentucky over the next few days as the stuff gets arise?
I can answer the question for what's here at U of L. So we are going to start working, really starting this afternoon, on this very stage, beginning to work through the first 1,000 people that we've identified in our healthcare workers. When we looked across our healthcare system, we've identified around 6,000 that would qualify for the inpatient contact areas. And so it'll take us, a few weeks to get through them. But, we start today, tomorrow, and I think the emails are going out at noon notifying those first 1,000 that they can sign up and come and get their vaccine.
And across the state, the 11 facilities will receive their shipments by Wednesday at the latest. There's day 1, 2, and 3. I anticipate that those that receive it Tuesday or Wednesday will be able to begin immediately. Remember, this came a day earlier than we expected, which is exciting. There is some hope that Moderna, depending on the process, could be shipped as early as Friday. Which means it could potentially reach the other acute hospitals or their partner that they're working with for vaccinations by early next week. Our hope is by the latest, all of our acute care hospitals will have this within the next 7 to 10 days. Now, most of that will be Moderna. Karen.
For people in long-term care, when will they be able to actually plug family members
So we believe that the first long-term care vaccinations will begin on the 21st. I believe we will be one of the first states in the nation that that's happening. We activated that program at the earliest date possible, and we are going to be pushing enough vaccines towards them to hopefully vaccinate our entire long-term care population within the first 2 months. We hope by March 1st, I know that gives us a couple weeks wiggle room, that will have been through not just the acute care nursing homes, but all the way down to assisted living and those that work within them. Now, we're still going to have to be careful about admissions, about the level of contact, but we're going to be able to open it up significantly moving forward.
Dr. Smith, what does this mean as a health assistant and healthcare workers who've been working insane hours for months? And how are you feeling? I'd just love to hear from them as well. I mean, how are you feeling?
Well, I don't think the insane hours are going to go away anytime soon, unfortunately. This is going to be a long process for us and for a healthcare system. But I've said this before, this is the first time that we've been able to do something besides just support someone through this virus. And, you know, we every day live through and see people that, you know, we are biding our time waiting for their body to overcome the virus and keeping them alive through that. This is the first time where it feels like we're doing something proactive instead of reactive. And I don't think you can underestimate that across the healthcare system. The beginning of these vaccines offers hope, for lack of a better term. Mm-hmm. It offers hope to all of us who've been working hard, and Dr. Briones Pryor and Dr. Saad and all of the nursing staff and our house, care staff, and I mean everyone, pharmacists, respiratory therapists. There are so many people that work every day to care for patients, and we've got a chance to begin to interrupt this virus cycle starting today.
And if I can, walking through this hospital today has been pretty special. Seeing the energy and the excitement, and that's everybody. Mm-hmm. Everybody from security to those working on the loading dock. Everybody knows that today is the beginning of something really special, and you can feel that energy here.
Mm-hmm.
Governor Beshear, do you know when you'll be vaccinated?
That's a good question. I'm likely to be vaccinated sometime early next week. Again, it's going to be part of setting the example on how they are safe, how they can be trusted. That'll be sometime during the second shipment, most likely the first Moderna that goes out. At that point, we feel like there is a significant amount out for our frontline healthcare workers. I want to make sure that we do it early enough to build the confidence. But at the same time, there's no way I was taking one of these away from these 5 amazing individuals and those that they work with.
Are you all discussing how, once we get to the point where it's more widely available to the public, will that primarily be through pharmacies, through people's GPs? How do you expect that will go?
So deploying this vaccine is a logistical challenge, but it is one that I've been waiting for and one that we tackle every single day. Certainly in the beginning, the logistics are pretty set with hospitals receiving them and knowing who comes into contact the most with COVID patients. And then the long-term care program, which CVS and Walgreens are ready to execute. Once we start moving from there, the logistics become more challenging. And that's why we are signing up providers all over the Commonwealth, from hospitals to pharmacies to potentially even some other areas, so that when we get that wonderful problem to have of having so much vaccine, we can open it up to everyone, that it's convenient. Now, I know we can do this. We went from having 0 tests in the Commonwealth of Kentucky to test COVID, and we're now at 358 locations and have done over 3 million tests. Now, we will have a challenge, certainly, once we get past this first group and move on to the second group, whether the federal government labels that as essential workers or people over 65 or 70, which step they take is still, I think, under some amount of debate.
Would any of those that receive the vaccine be willing to share their experience and their thoughts and feelings about this? We don't mind.
Yeah. Come on up, Val.
So I've been waiting for this vaccine for a long time. I've been on the COVID unit since March 17th. It's been that long. I remember when he called me into the office, and I was literally on the unit a few days after that. I had just told the governor right before when I walked over here, I just lost my 27th patient today. So the vaccine I took today was for her family and for the other 26 that I've lost, but for all of the other families and patients that I've held their hands, because me and the staff on the units, we're their family. We're the ones holding their hands. We're the ones telling them they're going to be okay. I miss my own family, so I did this today for my son, who's 7, and for my husband, because I want to be able to kiss and hug them. For the first 5 months, I didn't do that. We hug now, but it still feels a little weird. But I want to get back to seeing my family. I want families to be able to be at the bedside of their loved ones. As much as I'm glad that I got to hold their hand and be the ones to tell them it's okay, it's not my place to do that. Their families need to be there, so I did it for them. And I was proud to be the first 5. I was very honored that Dr. Smith asked me to do that, because for me, I've been waiting for it for a long time. And even though we still have a fight ahead of us, it's not over yet, at least there is a light at the end of my tunnel.
And what would you tell people who are hesitant?
I would tell them, I understand, because when, I understand that it's scary to get something new, and I wasn't at first excited to be a guinea pig, but I also think about what it means. The technology is actually not new. I mean, I did research before I got it. It's not like I just went up here blindly and let them stick me. But the technology is not new. It is safe. I wouldn't put myself at risk if I didn't think it was. So for those who are hesitant, read about it. Get yourself comfortable with it. Yes, don't be the first ones like me, but let others ahead of you get it. Talk to me in a week. I'll tell you how I feel after the next 24, 48 hours. But then also think about your loved ones. Think about the ones who've had it, the ones who could get it, and what you can do to protect them. So if you're not going to do it for yourself, do it for your loved ones.
Can you spell your name for us?
Sure. Last name is Briones Pryor. It's B as in boy, RIONES-PRYOR. And my first name is Valerie. They actually call me Dr. Val around here. So I was part of the Legacy Kentucky One, Jewish Hospital, St. Mary's Healthcare. But I've always been with the system that's been affiliated and now part of U of L Health for 16 years.
And you're Jewish?
I'm primarily a Jewish hospital.
What will this mean for your staff, the people you mentioned everybody's really excited. What is the feeling in your unit right now?
Well, today the feeling in the unit was a little bit of excitement. It was some excitement because we had other things going on, but because they knew where I was going today, there was excitement and there's hope. And we haven't had that in a long time. So excitement, hope, wondering about what the future looks like, because every day we come in and we do our job and we have bad days and we have good days, but now we're hoping for more good days.
Thank you very much.
You're welcome.
I think that's just one example of our healthcare heroes holding 27 hands. And being able to be up here, get this vaccine, after just having experienced that, again, I think shows you where we are, but also where we're going. Thank you. Thank you. Thank you to all of you. We couldn't do this without you. And we need you so much. And over the next couple months, please keep it up, and we're going to be right there with you. All right, thank you all very much.